Another instability that we see in the shoulder is up here where the collarbone joins the acromion, or the point of the shoulder blade. This often happens when bikers or skiers or hockey players fall onto the point of their shoulder. So the shoulder strikes the ground and the collarbone goes up, tearing ligaments in what's called the AC joint. The common name for this is a separation, a shoulder separation, versus a dislocation, which is when the ball and socket are dissociated or pop out of place. So many shoulder injuries can be treated without surgery, especially the more chronic overuse, wear and tear type injuries. The prime idea behind treating any shoulder injury is, first of all, identifying it, making sure it's not a referred injury from the neck or the elbow. Once we're able to identify the source of the symptoms or the pain is coming from the shoulder joint, then typically we discuss 3 goals. Number 1 is decreasing the inflammation. That can be done with anti-inflammatory medications orally if you can tolerate them, sometimes a cortisone injection in the shoulder, or a topical anti-inflammatory medications that are on the market now. Number 2 is at least temporarily stopping whatever activities are causing the pain. So if you're used to playing a lot of basketball or tennis, we may ask you to stop that temporarily until you're able to rehabilitate the shoulder. And that brings up the third treatment arm, which is rehabilitation, or rotator cuff physical therapy. So because this is an intricate group of muscles that work like a fine-tuned machine, it's real important to rehab or strengthen all the muscles around the shoulder blade in addition to the rotator cuff themselves. And that can be done under the guidance of a physical therapist or at home on your own if you're well versed in those exercises.